Patients with Parkinson's may experience freezing, and freezing is not referred to excessive feeling of cold, but it is a difficulty in initiating a step when patients are walking and they suddenly feel that their feet get glued to the ground or they get stuck when they are trying to step forward, or if they're going through narrow hallways, or if they are going to the elevators, or if they are going around the corners. So this phenomena of freezing can often lead to falls. What happens in freezing is patients have inability to generate effective stepping by both legs. The freezing can occur when patients start to walk, or when they are turning, or when they are going through a narrow space, or even when they reach a destination, they're still experiencing freezing and they can fall. Patients have difficulty in dealing with time-restricted activities such as entering a revolving door, stepping into elevator, or heavy traffic areas. And freezing is much less common when they are going upstairs as compared to when they are coming downstairs. Focused attention and external cues can help overcome freezing. It is usually observed in later stages of Parkinson's disease, although a slight freezing can occur in the early stages of Parkinson's as well. Visual and auditory cues can help to overcome freezing. When a patient attempts to cross a busy street before a traffic signal changes, the freezing gets precipitated. And if a line is drawn on the ground in front of the patient and they are told to step over this line, they are easily able to break the cycle of freezing. So this phenomena has been translated into use of inverted walking sticks, or stepping over another person's foot, or stepping over the carpet or floor patterns. Freezing is much more common in the environments such as train stations, shopping centers. If you are a caregiver, you should resist the temptation to pull the person forward or give advice, as it could often make the situation worse. There are many strategies which patients can use to overcome freezing. For example, they should imagine a step or a crack in the pavement and they should try to lift their foot over this. And their companion can help to put their foot in front and ask patient to step over it. If they are going through the doorways and elevators, they should try to look beyond, visualize when you want to be, rather than getting through the doorway. Using of the cues when you're going through a frame or a doorway is quite helpful, and this can break the freezing pattern. Also, tapping the hips or the leg when they want to move helps to lift their legs up and break this cycle. Marching on a spot or lifting your feet as much as possible is always helpful. Also, picking out someone ahead of you may mimic their walking. If someone is with you, take their arm and follow their rhythm. See what trick works best for you and inform your family members or caregivers, so whenever you are stuck with freezing, you can use those tricks. Other tools can also be used. For example, if you put a cable tie on the lower end of your cane and you try to step over this cable tie, this would help you to break the cycle of freezing. This is a very easy technique and you can make it yourself.